Hi, my name is Gabriel Altit. I'm a neonatologist at the Montreal Children's Hospital. Today we will be showcasing how to perform a lung ultrasound in a newborn. This will be as well used in the context of research project like a partnership that we currently have with Children's Hospital of Philadelphia for the PURPOSE study, in which we will be conducting lung ultrasound in the context of congenital diaphragmatic hernia. So for the context of the research, make sure that the images are being uploaded under the patient's chart. So here locally we use a Philips Epic, and I believe that at Children's Hospital you'll be using the Philips CX50, but you will be using the hockey stick probe, which is a linear probe. The hockey stick has the cursor that is basically pointing towards the end of the hockey stick, which means that whatever is here or image from the tip of the hockey stick will appear where on the screen you have your cursor, which on here is on the left side of the screen. So because the actual probe will be positioned longitudinally towards the head, the upper part represents the cranial portion of the images. So anything appearing on the left side of the screen will correspond to the cranial portions, and anything appearing on the right-hand side of the screen will be the caudal sections, or whatever is closer to the lower part of the body. On the actual acquisition of the images, it's very important to stay anonymous, which means that we will not see patient information on the actual image. So here you can see that the only thing we see is that we have the date and time, we have the probe, which is the L157IO, which is the hockey stick probe, but we have no patient information. The first image will contain, typed with a label, the study ID of the research project. The other thing that I want to showcase is that on your setups, especially on the actual machine of the Philips, we want to avoid using any kind of filtering effect. So that's why the XRes button, so here you can see XRes button, which is the same one for the Philips CX50. You don't want this to be on. You want this to be off, because this is something that will filter artifact, and for lung ultrasound, we actually want to generate these artifacts. The other things that are important in terms of preset is that your loops are set at 5 seconds of recording, so that when you acquire, this will retrospectively acquire the past 5 seconds of the image acquisition. Before I showcase on our patient Florence, who has accepted to be part of the project, what you want to do is have the probe pointing towards up. You want to do the 3 quadrants on each side. So if you're imaging, for example, the right chest, you want to do the upper, then the lower, then the lateral quadrants. When you are obtaining the actual images, you can start from the mid-clavicular line and drift down up to the nipple line. And for the lower chest, you want to start at the nipple line and drift down up to the costal margin, where we see the actual diaphragmatic surface or interface with the lung. And then the last view, which is the lateral, will start in the mid-axillary line and also slide down up to the diaphragmatic level that you will see on the chest ultrasound. The last thing I also want to mention is that when you acquire the images, you will see your ribs as big circles on the actual image because you will be cross-sectional to your ribs. So here I'm going to show on Florence, our baby who accepted to be part of the recording. You can get closer. We're going to look at the chest, and I want to show you the landmarks. So we have the nipples that are here. We have the claviculas that are here. And so the chest is divided. So here we have the thoracic cavity that ends here, the costal margin being here. And what we want to have is to separate the lung into 6 zones. The zones that are on the right side of the patient and the zones that are on the left side of the patient. we have the upper zones that are along the mid-clavicular line. We have the lower lung zone that is closer to around the nipple line. And then we have the lateral zone, which is around the mid-axillary line for the lateral zone. So 1, 2, and then 3. In order to start the recording, the first step will be on the machine to actually provide the study of the ID of the patient. So here I'm going to go into my presets, which are this preset of purpose. And I'm going to go in my label and call it purpose ID MCH test, or it can be 01, 02, 03, freeze and acquire. So already I have my ID here. This is an example of a first slide where we include the patient ID for the study ID, which for example for CHOP would be purpose CHOP 01 or 02 or 03. And as you can see, this image is actually anonymized, and all the images during the acquisition will be anonymized. So then again, here I circle in red the portion that is under the study ID, as well as the portion where you can see that the images are being anonymized for transmission. We can also see that the depth is already preset at 3 centimeters on the right hand side of the panel. I'm going to clear, and then I'm going to label. I have here the right upper, right lower, right lateral, and then the left upper, left lower, left lateral. So I'm going to start in my label with the right upper lobe. I'm going to take my clean linear probe, and the idea is to have the orientation towards 12 o'clock, which means longitudinal towards the head, so towards cranial. This means that the cursor is towards here, and on my screen, the cursor is on the left of the screen, so it indicates that whatever is here is cranial, towards the head, and whatever is going to be here is going to be caudal, which means towards the feet. So I have individual pack of gel, which are clean gel. We use 1 per patient at our institution. And once I have the gel, I'm able to start the recording. So I'm gonna put the probe in the first aspect of the lungs. And the idea is to have 5 seconds. And I'm doing this. And as I'm doing this, I make sure that I see my ribs, and I have at least 3 centimeters of depth. In my setup, I want at least 5 seconds for the loop. And so I'm going to start scanning. So here we can see the ribs, and we can see the A lines. I'm going to acquire. We can see the pleura. And as we have 5 seconds of breathing in the mid-clavicular line, I acquire this, where we see a lot of A lines here. Once I'm going to go to my second spot, which is the right lower lobe. So I then slide towards my lower chest, and then same thing. I start my 5-second loops, and I go down on the chest up to the diaphragm. Here I need more gel. So I start around the nipple line, mid-clavicular, and then I go down until I see my liver and my diaphragm. Go back up to the area of the nipple, and I can go down and acquire. My last view, label on the right. This time I'm going to go lateral, which means that for the patient, I want to go from the axilla to the diaphragm. So same thing. I want to see my ribs, and I go down up to the diaphragm area. So I'm going to restart, go mid-clavicular. You can see the screen. We can see nicely that there's ribs and A-line. And as I'm going down, I can see the liver and the diaphragm here. And that's it. We've done a unilateral right-sided lung ultrasound. We can do the same thing on the left, but for the project, the initial scans will only be on the contralateral side of the hernia. So this time, I'm gonna go in my labels, have the left lung upper pole, mid-clavicular, and as I slide from the clavicular area to the nipple line, I accept. Same thing, I can redo another sweep. So I see my ribs, I see my A-lines, and I slide down until I get to about the nipple line. Now I will do the same on the lower lobe and start at the nipple line, and I go down where I can actually see a bit of the heart, so I can do little movements on the chest to see more lung tissue. And here I get to the diaphragmatic area. And I finish with my lateral, where it needs to go at the mid-axillary line. And then I slide down up when I see the diaphragm. Back on the screen. So as we are here, we can see nicely the A lines, but if we would like to do an M mode, we could do an M mode to see the breathing pattern. So I'll just redo it. I'll do it here. Better. So this is an M mode where I can see that there's no signs of pneumothorax.